A successful apprenticeship program looks just like Ready, Set, Smile.
Ready, Set, Smile is a school-based program. We serve children that do not access dental care. So we go into communities where children come from families of low resources. We understand that this huge health disparity impacts these children greatly, and we are trying to turn that around.
Ready, Set, Smile has invested in their CHW apprentices. They have promoted their apprentices. They are in it for the long haul.
Community health workers make up the backbone of our organization.
I believe in that long-term systems change, right? I believe that health and oral health is health and that all people have a right to health access and to health literacy, but also to health care, to understanding what's happening in their bodies, but also in getting the support they need for it. And I just have not seen a more effective tool than a community health worker.
Apprenticeships are something that's not very new. In fact, some of the first legislation that was passed around apprenticeship models come from the 20th century. So apprenticeship models are something that have primarily been around to help support workers within construction and the manufacturing industry. But within the last years or so, we've seen quite an interest in apprenticeship model working for other industries as well. That includes healthcare. Within the state of Minnesota, community health workers have been something that has been around since the early 2000s. But we continue to see a lot of structural and organizational barriers to community health workers and entry into employment, as well as for employers to really fully wrap their minds around how can we best recruit CHWs, as well as retain them, as well as onboard and train and help develop their leadership throughout our organization so that they stay.
The value of the CHW apprenticeship program is that it will allow for CHWs to receive structured on-the-job training while they are working, as well as receiving academic training through the CHW certificate training program.
We benefit in many different ways, but I think the biggest one is the additional advantage it gives us in hiring and retaining excellent staff. So we really believe in the community health worker model and in the work that community health workers can do to bridge the gap between families and services and to work with system change. And we want people to be in these careers, and we want people to be in these careers for a long time. And so it helps us both introduce people to a career that they may never have heard about or wouldn't have known about, but also something that is a career ladder where they can move forward and get better pay here and other places. So just it both in finding staff and in getting them to stay. And I think they stay because they love the mission, but they also stay because they're getting professional development and their career is advancing. All three of our managers and supervisors are community health workers because we believe not just in the model, but also in growing people into greater positions. And I do think, I don't think people should be leading public and community health if they haven't been in the field. And the people that we are producing through this leadership program, through Apprentice, but also through working here, are people who can lead these programs anywhere.
Apprenticeship also offers a space where CHWs are able to learn and grow within that profession to develop and perhaps go on to leadership positions.
I still learned a lot by being on site and doing hands-on things, especially like practical skills that really helped. And it was very nice because I knew that I was in a supportive environment, and it just allowed me to be even more comfortable and confident as I was learning those skills. I learned how to build trusting relationships with the community. I learned more about the challenges and barriers that the community faces. I also learned how to be a successful oral health assistant, school liaison, which all were crucial to helping us achieve our mission. And shortly after that, I was promoted to be an operations director. That base knowledge that I learned during that initial period really helped me because I was really able to learn the kind of ins and outs of how we work. And so I'm thankful that they trusted me to take on this position and gave me the confidence to be able to do so.
Apprenticeship allows for a CHW entering into the field to learn and grow but to also have relatable on-the-job experiences that they can reflect back on what they've learned in their academic training so that they have that real-life experience coming into the profession as well as concurrently receiving their certificate training.
The mentorship part was very, very special and important to me because it was really a time for me to kind of take a step back and really reflect on what I was doing. It helped me feel even more supported, not just by Ready, Set, Smile, but by the Alliance as well. And I'd also like to highlight that I not only felt supported as a CHW, but as an individual as well, which made it even more special.
CHWs going through the apprenticeship program, they are already getting their education, their certificate through the Minnesota State curriculum in order to become CHWs, right? And they're obtaining acquired knowledge through that education. But at the same time, as an apprentice, when they work for an employer, they are able to then facilitate sort of on-the-job practical experience, that experiential learning that will help emphasize the work that they're going to be doing day to day, building the essential skills as a community health worker. All along the way, they are helped and supported by journey workers or mentors within the organization that they're employed with. And throughout that process, there's going to be opportunities for them to be supported not only by their employer, but also by the Minnesota Community Health Worker Alliance.
It is just a hands-on thing. You learn about health promotion, cultural humility. It is just like a paper thing. But then when you are actually doing it, when you encounter those events as you go on, you kind of listen to that lecture and then you go to an event today and then you meet like the same thing that you just read. It just hits different. So having those like hands-on actually helps the CHWs or like the employees to actually reflect on it and see like how this is not just topics we're talking about, but it's a real thing that's happening.
For someone like me as a CHW who's worked in various sectors, apprenticeship would have been key for my professional development. The experience that I have being a CHW since 2008 was all acquired through multiple jobs in multiple settings. Apprenticeship at that time, coming through the CHW profession for myself, would have been a key component in being able to acquire those skills and trainings on the job without having to job hop or be employed in so many different spaces.
Ready, Set, Smile has grown very quickly. Now, we had the pandemic slow us down, but literally since the pandemic, every year we are growing exponentially. So where do you find staff when you're growing that quickly? So the apprenticeship program has given us that pipeline so that we can bring in people who reflect the communities that we serve and get our robust training in oral health and go out into community and connect with our families. They touch every aspect of our program. What's unique about Ready, Set, Smile is because we're a dental program, we also have to serve the public with the services of dental care. Now, the community health workers work at every one of those levels, even to the point of being trained to be a dental assistant in our clinic. So, like I said, they are key to our work.
What we are seeing is that the programs and services that CHWs provide in various settings can really truly be upskilled as far as being able to provide additional services and supports that maybe the organization did not envision. But now they get a CHW who is well-rounded, coming through the program as a CHW being trained on the job. They're able to provide and perhaps even develop what a standard is for the CHW role and scope of practice.
It helps with us in a couple of different ways. So one is definitely that it helps us structure and think about career development, professional development. You know, we have many categories of things that we want our community health workers to know and to do really well. The apprenticeship program helps us think of those in very specific, distinct categories and sort of make sure we're addressing the different issues. It also helps us, I think it helps each individual apprentice also see that they are progressing on a route of professionalism and development. And it certainly also gives them something to show this is what I've done. This is how I've progressed. This is what I've learned. It was, okay, I took this training, this is how, and sort of aligning those, like these trainings helped me do this work in the field helped me learn and understand this. I think it helps connect a lot of those dots.
The Alliance provides support to the employers throughout the one-year apprenticeship program. What that support looks like is perhaps an employer does not have a vision about how they would like to utilize a CHW, or maybe they have a question about what are the key components of the role and scope of practice.
As an employer that's potentially looking at the idea of hiring a community health worker, there's been a lot of barriers and challenges around employment. Is there enough community health workers in the state of Minnesota? And how do we bill, et cetera, et cetera? And I think where the Minnesota Community Health Worker Alliance comes into play is to help support the employer in terms of understanding, like, what is the scope and the role of a CHW as a community health worker, but as within the organization itself. How do we help employers understand navigate that and where CHWs belong within their organization?
Another aspect of support that the Alliance provides to the employer is assisting them to understand where a CHW can be utilized, but also where they cannot be utilized. We also provide support with trainings, and that could mean what trainings might be appropriate for CHWs to achieve outcomes in a certain program or service area.
What's exciting about the apprenticeship program is it's a great way for employers who have never hired a CHW, right, to sort of gain that support that they need in order to build out the structures and the support mechanisms for community health workers to be successful in their organization. And the apprenticeship model is just such a really good medium point for both addressing the support of employers as well as CHWs. And I think for new employers or potential employers, this is a really great opportunity to kind of enter into an apprenticeship model to help bring CHWs on board, to help with understanding the scope and the role of CHWs, to help understand the onboarding process, understand what it would mean to retain really valuable CHWs.
The Alliance also provides employers with support regarding moving through the apprenticeship program if that employer would like to become an apprenticeship site. We support employers hands-on every step of the way throughout the registered apprenticeship process. And having gone through the process ourselves, we have a lot of knowledge in that area. The Alliance can provide employers with the basics of how a supervisor can support a CHW within an organization. CHWs do need to have strong advocacy, not only for themselves, but they need to have strong advocacy from their supervisors. A supervisor's role could be that they are helping others on the team to understand the role and scope of practice of a CHW. So if an apprenticeship site or an employer is struggling in that area, we can offer support there as well.
The importance of community health work is primary. As the systems that we live in exist today, and probably for a little while longer at least, helping people get access to what they deserve and that they are not just eligible for, but really have a right to in different services, both social services, but certainly health and health services, that is essential. If we're not doing that, we're not serving the community, we're leaving people by the wayside, right? So I think community health workers do that. And the more we can professionalize our field and ask people to do well and to do things at a high quality level and to be able to show it, the more legitimacy our field has. I think community health workers are wildly important, and things like the apprenticeship program help you demonstrate that this is I'm not just taking someone off the street and being like, hey, can you talk to someone? We're taking someone who has a passion for the community and a passion for access and for people and giving them skills and tools to be able to make systems work for people. And so I think it certainly has helped us retain and keep staff, but it also helps us professionalize and develop and really advocate for the field overall.
A successful apprenticeship program looks just like Ready, Set, Smile. Ready, Set, Smile has invested in their CHW apprentices. They have promoted their apprentices. They are in it for the long haul. Not only as an organization have they grown, but they have grown within their CHW workforce internally. And so Ready, Set, Smile is a great example of how apprenticeship allows for an organization to train, sustain, and promote CHWs.